Now, what is actually the meaning of the word anti-malarial drugs? Now, the anti-malarial drugs are the anti-parasitic chemotherapeutics drugs that are used to prevent and cure the malaria vector-borne parasitic disease. Now, Plasmodium falciparum, Plasmodium malariae, Plasmodium ovale, and Plasmodium vivax are four Plasmodium species that causes the malaria. But before we actually move towards the anti-malarial drugs, we will first of all must know about what is malaria actually. Now, malaria is one of the such disease whose appearance may be related to the socio-economic status of the society. It is mainly a disease of tropic and subtropic countries. Though on large scale malaria eradication programs are initiated by our government from 1957, this disease still affects about 200 million people and causes at least 2 million deaths per year. Now, malaria in human is caused by the infection with a Plasmodium parasite of genus Plasmodium ovale, Plasmodium malariae, Plasmodium vivax. Now, these parasites send their asexual phase in a body of man and the sexual phase in the body of female Anopheles mosquito. Out of several hundred known Anopheles species, 4 species infect man, and these species are Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, and Plasmodium ovale. Now, this malaria is transmitted in human via a bite from the infected female Anopheles mosquito. This is vector. Now, those 4 species, that is Plasmodium vivax, Plasmodium malariae, Plasmodium ovale, produces a mild forms of the malaria by destroying the RBC, that is red blood cells, in the peripheral capillaries and thus causes anemia to the patient. The most dangerous species is basically Plasmodium falciparum. In this case, the infected red blood cells become sticky and forms lumps of the capillaries of deep organs and visceral and deep organs of our body and cause the microcirculatory arrest. Now, out of these 4 species, that is Plasmodium vivax, Plasmodium malariae, and Plasmodium ovale, they are not dangerous as much as compared to the Plasmodium falciparum species because these 3 species they destroy the RBCs in the peripheral capillaries and simply causes anemia. Whereas the most dangerous species is Plasmodium falciparum, will infect the RBCs, destroy and forms the lumps of the capillaries of the deep organs of the body and cause microcirculatory arrest. This disease, already we have discussed, still affect 200 million people and causes 2 million deaths per year. Now, what are the basically symptoms involved in the parasitic infection? The symptoms started from the fever, shivering, joint pains, headache, vomiting, convulsions, and coma sometime. After mosquito bite, these symptoms are occurring after 7 to 9 days of the mosquito bite. Now, as we have already discussed, the malarial parasitic infection is going to have his life cycle in 2 phases, that is asexual cycle and sexual cycles. Now we are moving towards the discussion of sexual and asexual cycle. Now, already we have discussed that the asexual cycle is carried out in the body of human, that is man, and the sexual phase is carried out in the body of female Anopheles mosquito body. Now, what is the uh, etiology and what is the life cycle of this malarial parasite? The female Anopheles mosquito feeds on vertebrate blood. Now we all know these female Anopheles mosquitoes, they feed on the vertebrate bloods. Malaria infection is initiated through the bite of infected Anopheles mosquito, which release motile sporozoites into the human blood. So they are going to release the motile sporozoites when they are going to bite to the skin of human or the vertebrates. Now, these sporozoites, they are released into the human bloodstream. Within 1 to 2 hours, these sporozoites get entry into the parenchymal cells. Within 1 to 2 hours, these sporozoites are entered into the parenchyma cells of the host liver cell. So this is a liver cell of the human being. When the Anopheles mosquito bite to the vertebrate or human body, within 1 to 2 hours, these sporozoites are entered into the parenchyma cells of the host liver. Though through repeated nuclear divisions, these sporozoites multiply and develop into the schizones. These sporozoites, when entered into the hepatic liver cell of the host, that is human, they multiply repeatedly and develops into the schizones. Now, after a period of 10 to 16 days, liver cell rupture due to multiple repeated divisions of these schizones. This liver cell, due to the multiplication of these schizones into the parenchymal liver cell, they destroy the liver cell ruptured due to the multiple repeated divisions of the schizones. This results in the release of approximately 20,000 merozoites into the circulation. So what is the pathway? First of all, this Anopheles mosquito bite to the vertebrate cell. They release the sporozoites into the bloodstream. Within 1 to 2 hours, these sporozoites reach hepatic cells. Now, hepatic cells invade with the sporozoites. They are going to mature and formation of schizone is there. Now, after 10 to 16 days, these schizones rupture and releases approximately 20,000 merozoites into the circulation. So, these released merozoites are in the number of 20,000. This stage is known as pre-erythrocytic stage. That is entry into the hepatic cell, formation of schizones, formation of mature schizone, and release of merozoites. So this is particular, that pathway or this pathway is known as pre-erythrocytic or exoerythrocytic phase of infection. So up till this is the exoerythrocytic or pre-erythrocytic phase of the infection. After that, these merozoites are now enter into the circulation and invade erythrocytes. Some merozoites invade fresh liver cell and repeat erythrocytic stage. Some merozoites go again into the liver cell and fresh liver cell and repeat erythrocytic cycle. Erythrocytes are invaded by the merozoites for the reasons, and these reasons are: the plasma constituent and hemoglobin serve as a source of several amino acids which are necessary for the survival of the parasites. Now, why these parasites are going to invade erythrocyte or RBC cell? Because our RBC cell is going to have the source for the several amino acids which are necessary for the survival of these parasitic cells. The next reason is for rapid multiplication of the merozoites, the purine base, that is presence of adenine and guanine, are obtained from the erythrocytes, which are then utilized to synthesize parasitic DNA and RNA molecules. So for the reasons they need amino acid and other nutrient material, they are going to invade the erythrocyte cell, as well as they need the ready-made nuclear material which is already available in the erythrocytic cell. By using this available nuclear material, they multiply their cells. Now, when they are going to invade to the erythrocytic stage, what happens? The pentose and phosphates molecule are necessary for the nucleic acid synthesis. The protozoal parasites do not have presence of the pentose and phosphate groups from the raw material, but obviously it is the host cell who is going to suffer or who is going to supply these pentose and phosphate nucleus. Now, inside the erythrocytic cell, these merozoites continued to grow. So these merozoites, when they are going to enter in the erythrocytic cell, they are continued to grow and go for the asexual multiplication, which results into the formation of daughter cells, schizones. Due to the repeated multiplication of the latter, erythrocytes is going to rupture and release about 6 to 24 merozoites into the circulation. Earlierly, they will enter in the hepatic cell. Later, they are going to enter in the erythrocytic cell. They do their multiplication in the number, and when it is going to be ruptured, they are going to release approximately 6 to 24 merozoites into the circulation. Each merozoite again invade fresh erythrocytic cell, and the cycle of asexual multiplication is again continued. They are going to invade to the erythrocytic cell. They are going to use the phosphate and nuclear material from the erythrocytic cell. They multiply themselves, and due to this multiplication, this erythrocytic cell is ruptured. Approximately 6 to 24 merozoites are released into the circulation, and out of these merozoites, some merozoites are again utilized for invading and multiplication of the more number of merozoite cell. This stage is known as schizogony phase of the infection. So this is the pre-erythrocytic phase, and this is a schizogony phase of the infection, that is entry into the erythrocytic cell till they are ruptured and again reutilized for the further multiplication of the merozoites. This particular phase is known as schizogony phase of the infection. It continues for 48 to 74 hours. This particular pathway requires 48 to 72 hours. Febrile clinical manifestations are witnessed due to the schizogony phase. Now, after this phase of schizogony, that is rupturing of the erythrocytic cell, some merozoites are again reutilized for the further multiplication, and after this, some of the erythrocytic merozoites develop into the male and female gametes by some unidentified mechanisms. So they are developed into the male and female gametes due to some unidentified mechanism. Such infected blood, when ingested by the female Anopheles mosquito, the sexual forms, that is released male and female gametes, undergo reproduction within the gut of insect. So these released male and female gametes, when the female Anopheles mosquito again bite to the skin of the man. So what happened? They undergo reproduction within the body of or gut of the insect. The result, they are going to form the gamete. They fuse the gametes of male and female gamete, and they are going to result in the formation of the zygote. Through various stages of development, gives rise to the infective sporozoite. The latter get localized in the salivary glands of the insect. Now, through so many pathways or through many steps, this zygote is converted into the ookinete. They are going to form the oocyst, and this oocyst after multiplication will burst out, and again they are going to release the sporozoites into the salivary glands of the female Anopheles mosquito. When they are going to enter into the salivary glands of the female Anopheles mosquito, the host, after that, again female Anopheles mosquito will bite the vector, that is main infected mosquito bite, and to the healthy person, the story thus again get repeated, that is formation of schizones, formation of merozoites. Some merozoites are repeated for the erythrocytic replication. Some merozoites undergo formation of the gametes, and later on these gametes are fused inside the gut body of the vector. They are going to fuse those gametes, and there is formation of the zygote. Now this zygote undergo formation of oocyst, and the burst oocyst will result or will release the schizones in the salivary glands of the spirozoites in the salivary glands of the female Anopheles mosquito. Again, this female Anopheles mosquito will bite the healthy human being, and the asexual pathway followed by sexual pathway of phase of malaria infection is continued. So this is all about the life cycle of malarial parasite. Now, what are actually the anti-malarial drugs that we are going to use for the treatment of malaria? Now, in the chemical classification we have already discussed, they are classified under the class quinolines, bigonides, and miscellaneous class. Now, depending upon the today's classification, which is based upon the clinical uses of drugs, they are classified into sporozoiticides. That means they are going to be effective against the spirozoites, and these drugs are primaquine, chloroguanine, pyrimethamine, etc. Then the next class is tissue schizonticides, radical curative and preventing relapse. So they are going to stop the growth of tissue schizonticides. That is, the drug is primaquine. And the next and very important class is blood schizonticides. Now this blood schizonticide, that is entry of schizones into the erythrocytic cell, they are further divided into two classes: slow acting blood schizonticides and rapid acting blood schizonticides. So the class slow acting blood schizonticides and the classes are proguanil and pyrimethamine, and the rapid acting blood schizonticides are chloroquine, mefloquine, quinine, and atovaquone. The next class is the drugs which are used in the prophylaxis, that is proguanil, chloroquine, mefloquine, and atovaquone. The next class which are used in the clinical attack, that is chloroquine, mefloquine, quinidine, atovaquine. Further class that are gametocytes, they are going to kill the male and female gametes which are formed in the body of man cells to prevent the transmissions. That is, for example, Plasmodium vivax, Plasmodium malaria, and Plasmodium ovale. The gametes of these three classes are killed, that is, through the drug that is chloroquine and quinine. And the last and very important class is Plasmodium falciparum, and the drug utilized for the treatment of this particular is primaquine. Now, based upon the chemical structure, these drugs are further classified as synchron alkaloids and their derivatives. Though are synchron alkaloids, quinoline, methanol, 4-aminoquinolines, 8-aminoquinolines, 9-aminoquinolines, and naphthaquinones and biguanides, and the last classes diaminopyrimidines, sulfones and sulfonamides. Some sulfonamide derivatives are also used as antimalarials, endoperoxides, amino alcohols, that is halofentrin. Then some of the antibiotics are also used in the treatment of malaria. And the last and very important class is manichbase, that is phenolanaridine, also used as an anti-malarial agent. So this is all about the today's class. In this lecture summary, we have discussed about what is malaria actually, what are the four important basic classes, basic classification of the Plasmodium malaria species, that is Plasmodium malariae, Plasmodium ovale, Plasmodium falciparum, and Plasmodium malariae. So, and just now we have discussed about the detailed classification of the anti-malarial drugs. Thank you. Yes, dear students of third year B Pharmacy, in the subject of Medicinal Chemistry 3 Theory, today we are going to discuss about the anti-malarial drug. This is included in the chapter number 2, and this is the third lecture from the chapter number 2. Before this lecture, we have already discussed everything about what is prodrug, what is the basic concept involved in the design of the prodrug, what is the need that we will go for the design of the prodrug, and so on, and some of the applications of the prodrug. Now, in today's class, we are going to discuss about the anti-malarial drug, and the points, the syllabus points included in this particular bit is etiology of malaria, and the drugs involved are quinoline and their derivative, their structure activity relationship, and examples of the quinoline derivatives, then biguanides, dihydrotriazines, and some of the miscellaneous derivatives that they are used as an anti-malarial agent. So this is the name of my channel. Please do subscribe, and we are going to proceed for the discussion of anti-malarial drug. Before we actually proceed towards the